Wonderful. Thank you. So thank you for this, waiting for these technical issues to be solved. I would like to introduce a new approach to treatments and how to enhance the treatments in the clinic with using collagen supplements. And a little bit of background about me. I'm a medical doctor with over 15 years experience in the clinic. We're based in London. I am founder of Clinicbe in Knightsbridge, and we always focus on collagen stimulation and regenerative protocols. Why every clinic, aesthetic clinic, should be talking about collagen. I'm sure that many of you notice it on many of your patients, that patients are actually losing collagen faster than they are producing it. And we for years been focused on stimulating collagen through treatments, but only few of us address the patient's biological capacity to produce collagen in the first place. So as much as we try to stimulate the collagen in their bodies, it's very important to understand that obviously the final results depends on their ability to actually produce collagen. And obviously we hear about that collagen production begins to decline from the age of 25, and women lose up to 30% of collagen in the first 5 years after menopause. And that loss accelerates as well with further aging, menopause, as we mentioned before, but as well any hormonal imbalances, smoking, UV exposure, stress, poor nutrition, chronic inflammation, weight loss, and over the last years, very important group, it's connected with GLP-1 agonists use, so with all products that use for the weight loss. And the new challenge with GLP-1 patients, it's the fact that they lose volume and fat tissue rapidly. Obviously, that reduces the skin elasticity and creates facial hollowing, but as well as skin laxity, poor skin quality. And the problem is as well with the reduced intake of nutrients in food, is that the protein intake usually lowers, and then that contributes to poor actually active amino acids available for producing new collagen, so they don't even respond to the treatments very well. The most important thing is to recognize the signs of collagen deficiency, and that we can see very often, but there are some signs that maybe they are not so obvious. Obviously, skin laxity, crepey skin, very thin and liny or wrinkly skin, poor wound healing. That's a very good thing to actually ask on our consultations with the patient when we know that how they respond to previous treatments as well. Volume loss on the face, and as well that can be connected not only with weight loss but as well with loss of bone structure, and obviously with age that's a very common issue, but as well with those patients who lose weight rapidly can be connected, can contribute as well, that weight loss, to lost bone structure as well. And now another thing that we can notice or see in our consultations is slow recovery. So they take long time to recover after the treatments, and they need treatments very often. So they don't respond as well as maybe other patients, or and younger patients as well. So we know that the response will be different in a patient who is 25 to someone who is in their 40s. But actually that difference is very much connected with the capacity to produce new collagen and obviously baseline of the collagen in the system. Another symptoms of the collagen deficiency, it's the general symptoms like joint pains, poor recovery, and obviously lower bone density. They might be just signs of aging. As I mentioned, we almost expect for older patients to respond less, but it might actually be representing reduced collagen reserve, and obviously smaller biological capacity to produce new collagen. And for years in aesthetic medicine, we have focused on stimulating collagen, aggressively trying to do different treatments and injectables, but we very rarely look actually in the other side, which is capacity for patients to respond to our treatments. And that kind of leads us to the next questions: why some patients don't respond well to biostimulators or treatments that stimulate production of collagen or hair loss. And again, the results might be few, but main ones are reduced fibroblast activity. So fibroblasts are not activated enough to produce new collagen. Age-related collagen decline, nutrition deficiency, insufficient amino acid availability, or actually inadequate vitamin C intake. And obviously all the elements that I've mentioned before, like smoking, sun exposure, and prolonged stress. The treatment can only stimulate the body, what is body capable to produce. So that's why the final results, it's actually a combination of the treatment that we provide and a patient's response to the treatment. And then we know that when we don't have enough fuel in the body to produce new proteins like collagen, the result might be slower, they might be weaker, and they might need the treatments more often because they will just not be sustained for a long time. And that's why the collagen supplementation actually becoming clinically relevant. It's like when we see, for example, bodybuilders, we know that it's very important to stress the muscles and activate the muscle growth by loading and exercise. But in the same time, it's very important to take enough proteins to build new muscles. It's the same thing with our treatments. We provide treatments that stimulates the rejuvenation of the skin and improvement of collagen in the skin or hair, that we actually have a substance, our patients have actually fuel in their body to produce those new proteins. And I'm sure that we all come across many different collagens and try to integrate them to the practice. Sometimes might be a bit tricky because obviously there are multiple brands out there. They have sometimes very poor compliance of the patients, and I don't know how you feel about this, but sometimes when I don't trust the product, I give up and stop recommending it, because if I don't see a good response and consistency, then it's discouraging to keep going with the product or with actually following up with the patient. How do we actually evaluate the collagen supplements? And I was in the same place years back when I tried to introduce the collagen product to the clinic. And actually, I got really, really confused and tried different products on the market. And none of them were actually really very successful. And then after deeper and longer research, I've realized that there are certain things that actually are very important and clinically supported and evidence-based that can change the collagen supplementation and what we offer significantly, and actually works very well. The most important thing is the dose. Many collagen products are underdosed. If you look on the daily dose, most of them have anything from 5 to 12, 13 grams. That's usually the maximum that they offer. And actually, in the when we take in consideration the absorption and as well amount of peptides that is used for bones, muscles, and joints, if we want to actually make a difference in the skin, we have to almost double the dose. So it's actually about 20 grams of collagen that it's needed to make a difference on a daily basis, to make a difference in our skin. Molecular weight, it's as important or even not more important because only peptides under 25 kilodaltons are bioavailable, and that's the burden that we shouldn't give molecules bigger than 25 kilodaltons, because then if that's the case, they will be broken down in single amino acids and used mostly as a source of energy or building block for any other protein. That's why things like broth or gelatin or any natural form of collagen doesn't work very well, because actually those long chains have to be broken into small peptides to be able to be directly absorbed in our guts. And then peptides composition, which is again another very important thing to take in consideration when we consult our patients, is that not all collagen is the same. We have many types of collagen in our body. The most common and most apparent in our body is collagen type 1 and 3. And the collagen type 1 builds the skin strength and structure, and it's very often in a collagen product. And the same with collagen type 3, which contributes to skin elasticity. So it's slightly different form of collagen. But if we look holistically on our patients, actually we need the collagen type 2 if we want to support the joints, and collagen type 5 for hair follicle support. So actually most of our collagen won't work for hair loss because they don't have the type of collagen that is necessary for growth of new hair. And then another type of collagen that is important is collagen type 10, which participate in rejuvenation of supportive matrix of our body, and as well vascularity, so vessels and as well gut. So those elements are important to look at when we look on the label of our products, to see whether they actually are effective, will be effective in our patients. The next element that very often we come across is the purity of the product. So a lot of the products that are on the market have a lot of artificial flavoring, sweeteners, fillers, and additives. All of them will impact absorption, but as well very often patient compliance, because if it's enough that someone doesn't like orange and orange flavoring, and the product has orange flavoring, they're not going to take the product longer than a few days because they will be put off by this. And as well, sometimes those sweeteners can make patients nauseous or uncomfortable. And plus, as well, the most important is we don't want to give to the body anything that actually will load it with artificial and unnecessary substance. So it's very important that the product is pure. Next thing is the source of collagen. I came across that very often, that I'm asked how the product is sourced, whether it is whether the collagen it's organic, whether it's ethically sourced, where it comes from, where it's produced. And again, most of those things are very difficult to find on the packaging, and most brands would not inform us. And to be honest, if I'm not informed, I cannot really trust the source of the product. So it was very important to be transparent and have the highest quality of a collagen that we provide for our patients.